How about that? Okay, so how might the diversity of these Medicaid risk adjustment models across states create compliance challenges for providers and health systems operating in multiple states? So I know working in the past at a large healthcare organization that was across multiple states, it was a doozy. um, and it created a lot of headaches because there were things you had to know. So imagine you're a coding manager for a health system with facilities in 5 different states, for example. And then each state might use a different risk adjustment model with different priorities. So, state A might use the CDPS model, which has those 52 categories within 19 major categories, as we discussed. Well, state B might use the Medicaid RX model, which incorporates pharmacy data. And then state C might use a completely different approach, or there may be one that uses a combination of the two. So this diversity creates several compliance challenges for because your coding education has to be state specific. How about that? You can't train all your coders the same way across your organization. Your internal auditing processes need to account for these differences, and what's considered appropriate in one state might be flagged as a potential issue in another state. Your EHR and coding software needs to be configured differently for each state, which creates IT and workflow complications. And lastly, reporting and analytics become much more complex when you're trying to compare performance across states using different models. So, the solution, many multi state organizations are creating state specific coding teams or specialists who become experts in their particular state's models. Others are investing in advanced software that can apply different rule sets based on the patient's state of coverage. And still others are partnering with vendors who have specific expertise in each state's Medicaid program. Again, whatever approach that your organization may take, documentation is key. So make sure your policies and procedures clearly document which model applies to which patients and how your organization addresses these differences in daily operation.